So teeth, whenever they get bad, they're basically splinters. The body's trying to get rid of them at that point. There's infection all the way around it. It's just that the periodontal ligament is so strong, the bone around it is so designed to keep that tooth in that it's keeping the tooth in. But the body wants that tooth out because it's causing this infection. So the moment you pull that tooth and get that splinter out, everything heals up. So this guy's got the splinter in his hand, you pull that splinter out, all that inflammation and redness basically goes away overnight. That's the same story with dental infections. So many times these animals have these huge infections, even where the bone looks like it's osteomyelitic, and you pull the tooth and all that goes away. And it goes away quick. I mean, animals feel better quickly. So just think of teeth when you talk to owners. Bad teeth are splinters. Take the splinter out, all that redness and infection and everything goes away with it. So I'm going to beat this horse. I'm sorry. Antibiotics should not be the source of removal of the infection. You should extract, debride, endodontically treat. Only use antibiotics if there's a reason afterwards. So I'm sorry I made this as big as possible. It's still kind of hard to read. But the CDC used the information from the ADA, and I put this one up first. There's another flyer or flow chart after this that will kind of make this a little bit make a little bit more sense. But DCDT is the definitive conservative dental treatment. So basically that means treat the tooth. So extract, root canal, debride, medicate, or debride and flush. So if you can do those things relatively acutely within a few days, prescribed antibiotics is only when there's basically an acute infection there. So periodontal disease is never really an acute infection. Sometimes you do get abscesses that blow up, and those are times that you would potentially do it. So if there's swelling, things like that, inflammation, swelling, heat, pain, those are potential reasons to do it. But also, if you can go in there and take that tooth out that day or the next day, you may not even want to throw antibiotics at it. You just throw anti-inflammatories at it and make the dog or cat feel better for that night, and then take things out. Whenever, like if you're referring to us, it's going to be a little bit. There are times to prescribe antibiotics. Basically, if you've got, again, the same thing, an abscess, whether or not it is active or not, you could potentially throw antibiotics at it. So I will elaborate on that with the next slide. So this is the kind of the flow chart of what they mean on that right side of the last chart. So pain or swelling, that's the first thing. If you have pain or swelling, that's when you use antibiotics. If you don't have pain, or if you don't have swelling and you just have pain, you typically don't use antibiotics. So it's a swelling that pushes you towards antibiotics. And then they go on to kind of break it down into what antibiotic to use. So penicillin allergy, we don't really worry about that too much in pets, but their first line for people that don't have penicillin allergies is going to be amoxicillin. And then if they do have a penicillin allergy, but not anaphylaxis, they're going to do cephalexin. If they do have anaphylaxis, azithromycin, because technically cephalexin is close enough to penicillins to push somebody into anaphylaxis potentially. So, and then if the first line fails, then you're going to go and add metronidazole to it, and then